Ladies and gentlemen, on behalf of the College of Pathologists of Sri Lanka, I warmly welcome you all for the presidential inauguration and the 50th anniversary celebrations of the College of Pathologists of Sri Lanka.
Please remain standing for national anthem.
Sri Lanka Mata, Abba Sri Lanka, Namo 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 Mata, Sundara Sri Varini, Surani Ati Somamana Lanka, Ranya Kalaya Mekamal Balakulu Bini Jaya Bhumi Ranya, Appa Hatta Sapa Siri Setta Sadhana, Jeevana Evaga, Vilikanu Mena Appa Bhakti Puja, Namo Namo Mata, Appa Sri Lanka, Namo 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 Mata, Upave Appa Vidya, Upamaya Appa Satya, Upave Appa Shanti, Appa Hada Tula Bhakti, Appa Aloke, Appa Ge Anuprane, Appa Jeevaname, Appa Muktiya Opave, Nava Jeevana Devini, Vidina Appa Pupudu Karan Mata, Jnana Veena Vada Vandina Ragena Yanu Mena Jaya Bhumi Kara, Ekamavatake Karu Kala Vedina, Yamu Yamu Vinopama, Prema Vada Sarva Veda Turalala, Namo Namo Mata, Appa Sri Lanka, Namo 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 Mata.
In keeping with tradition, we begin with the lighting of the oil lamp. For this task, I cordially invite the chief guest, Professor Neelakanthi Ratnatunga, Emeritus Professor, University of Peradeniya. Guest speaker, Professor Chandu De Silva, former Chair and Senior Professor, Department of Pathology, University of Colombo. President of the College of Pathologists of Sri Lanka for the year 2025, Professor Priyani Amaratunga. Past President for the year 2024, Dr. Priyanka Abegunasekara. President-elect, Dr. Mangala Bopagoda. Vice President, Dr. Shereen Susay. Representing past presidents, Professor L.R. Amarasekara. Joint Secretaries, Dr. Lalani De Silva and Dr. Priya Amaravira. Treasurer, Dr. Ramani Punchiheva. And Chief Editor, Dr. Harshima Vijayasinghe. Thank you.
Now I would like to cordially invite the following dignitaries to please take their seats at the head table. The chief guest, Professor Neelakanthi Ratnatunga, Emeritus Professor, University of Peradeniya. Guest speaker, Professor Chandu De Silva, former Chair and Senior Professor, Department of Pathology, University of Colombo. President of the College of Pathologists of Sri Lanka for the year 2025, Professor Priyani Amarathunga. President for the year 2024, Dr. Priyanka Abegunasekara. President-elect, Dr. Mangala Bopagoda. And Joint Secretaries, Dr. Lalani De Silva and Dr. Priya Amaravira. The welcome address will be delivered by the President-elect, Dr. Mangala Bopagoda.
Good evening, ladies and gentlemen. On behalf of the President and the Council of the College of Pathologists of Sri Lanka, I am honored to welcome you to this momentous occasion, the celebration of the 50th anniversary of the College of Pathologists and the induction of the President 2025. We are deeply honored to have in our midst two distinguished guests whose contribution to the field of histopathology has been unparalleled. Our chief guest, Professor Neelakanthi Ratnatunga, Emeritus Professor, University of Peradeniya, and our guest of honor, Professor Chandu De Silva, former Chair and Senior Professor, Department of Pathology, Faculty of Medicine, University of Colombo. Both these eminent personalities are no strangers to our pathology community and have dedicated their careers to improving the medical education and pathology services in our country. Dear Madam and Sir, we are indeed honored by your presence and we extend a warm and heartfelt welcome to you both, appreciating your presence despite your busy schedules. I warmly welcome the past presidents and the members of the college who are present today and all distinguished invitees to this important ceremony of the College of Pathologists. Our primary purpose today is to formally induct a new president who will guide our college into the future. The role of the president is pivotal as they pledge to steer our college towards greater achievements and continued success. We extend our heartfelt gratitude to our outgoing President, Dr. Priyanka Abegunasekara, and the Council for their dedication and commendable service. It is with great pride and immense joy that we gather today to mark a remarkable milestone in the history of our college. This event signifies a momentous juncture in the life of our esteemed college, where we come together to celebrate the spirit of excellence and commitment that has defined us for 50 years. Over the past 5 decades, the College of Pathologists of Sri Lanka has strived to uplift the quality of pathology services in Sri Lanka, working tirelessly to maintain the high standards, and has been a cornerstone of medical education, research, and patient care. Today, we continue to build upon this legacy with a commitment to achieving even greater heights. Let us embrace this occasion with enthusiasm and a renewed dedication to the principles that define our college. Together, we will continue to make a meaningful impact on healthcare in Sri Lanka and beyond. Ladies and gentlemen, once again, I warmly welcome you all and wish you all a pleasant evening. Thank you.
Thank you, Madam. It's now time for the presidential induction ceremony of the President of the College of Pathologists of Sri Lanka for the Golden Jubilee Year 2025. I invite the President for the year 2024, Dr. Priyanka Abegunasekara, to introduce the President for the year 2025, Professor Priyani Amarathunga.
Priyani Amarathunga was born in Kahatuduwa and had her primary education at Olaboduwa Soisa Mahavidyalaya and Kasbawa Dharmasena Artigala Balika Vidyalaya. Having excelled in grade 5 scholarship examination, she entered St. Paul's Milagiri Girls' School in Colombo for her secondary education. As a foreshadow of future leadership roles she would achieve, she served as senior prefect, achieved ranking in the school cadet platoon, and was the leader of the school Saukyadana movement during her school days. She entered the Faculty of Medicine, University of Colombo, and graduated as MBBS in 1998 with second-class upper division honors, with distinctions in anatomy, biochemistry, physiology, as well as in pathology, a future sign of her chosen specialization. After completing internship at Sri Javadanapura Hospital and subsequent appointments in Ministry of Health, she entered the postgraduate program in pathology at the Postgraduate Institute of Medicine, University of Colombo in 2002, under the mentorship of Dr. Ruchira Fernando, Dr. Abe Ileperuma, Dr. S.D. Athakorala, Dr. Mala Tudave, and Dr. Saroja Sirivardhana. She obtained the diploma in pathology in 2004 and MD pathology, histopathology, in 2006, where she ranked first in the merit list. She furthered her expertise with overseas training at St. Vincent's Hospital in Melbourne under the guidance of Professor Richard Williams, and at the Royal Women's Hospital in Melbourne under the guidance of Professor Jan Payman during 2008 to 2009. She is currently completing a diploma in pediatric pathology with the International Pediatric Pathology Association. Professor Amarathunga's contributions to academia are wide-ranging. She was a demonstrator in the Department of Anatomy, Faculty of Medicine, Colombo in 1998, before joining the Department of Pathology as a lecturer in 2007. She was promoted to senior lecturer in 2010 and became a professor in pathology in 2019. Within the university, she has been instrumental in curriculum design, development, and revision, serving as the secretary of the Curricular Development and Evaluation Committee from 2016 to 2019. She has also contributed significantly to quality assurance in state universities as the coordinator of the Internal Quality Assurance Cell of the Faculty of Medicine from 2017 to 2020, and as a reviewer for external degree programs under the Quality Assurance Council of the University Grants Commission. Presently, she serves as the head of the Department of Pathology and the director of the Center for Diagnosis and Research in Cancer at the Faculty of Medicine, where she was also a founding deputy director of diagnostics. Additionally, she had served as assistant secretary of the Faculty of Medicine Teachers Association. In addition to her undergraduate teaching in the medical curriculum, Professor Amaratunga has trained over 25 postgraduate trainees in histopathology within the Faculty of Medicine and National Hospital of Sri Lanka training cluster. These trainees have gone on to become consultant pathologists, working both in Sri Lanka and across the globe, a testament to her commitment to nurturing future generations of specialists. Presently, she is a member of the Board of Study in Pathology and is serving as the MCQ Core Group Coordinator for Histopathology. Her contributions to postgraduate education also include serving as a resource person and an examiner for numerous postgraduate courses, including MD Pathology, Surgery, and Obstetrics and Gynecology. As a respected researcher, Professor Amaratunga has authored 20 articles in peer-reviewed and indexed journals, contributed chapters to books, presented over 100 papers at scientific sessions, winning 12 awards for research presentations. She delivered the prestigious SARC Academy Oration in 2017 at the joint conference of the SARC Academy of Cytopathology and Histopathology and the Association of Clinical Pathologists of Nepal, held in Kathmandu, on pathologists' role in identifying preventable causes of perinatal and fetal deaths. She has been a sought-after resource person at national and international conferences, including the European Congress in Cytology and conferences of the SARC Academy of Cytopathology and Histopathology in multiple occasions, and also contributed as a resource person at the advanced course in pediatric pathology conducted by the International Pediatric Pathology Association in 2023. With 24 years of experience as a histopathologist, Professor Amaratunga has specialized in medical renal pathology, tumor pathology, and perinatal pathology, and has expanded her services to many hospitals in Sri Lanka. Her influence extends beyond the university into professional colleges. Professor Amaratunga has been an active member of the College of Pathologists of Sri Lanka. As secretary in 2012 and 2013, and conference coordinator in 2014, organizing the joint AAP-IAP and the CPSL conference, and participating as a council member over many years. Other responsibilities include being joint secretary to SARC Academy of Histopathology and Cytopathology from 2013 to 2015, and contributing to the Perinatal Society of Sri Lanka as a council member, as well as serving as the assistant secretary of the Sri Lanka Medical Association in 2015. Her leadership is further demonstrated by her role as co-chairperson or convener of various subcommittees and working groups within the College of Pathologists of Sri Lanka, including Laboratory Accreditation Committee. She was the first convener of the National Immunohistochemistry Laboratory Committee and served as the coordinator of the cervical cancer screening program for many years. She has also involved in the National Birth Defects and Fetal-Infant Death Surveillance programs. Additionally, Professor Amaratunga has authored and edited numerous national guidelines, including those for handling surgical pathology specimens, gastrointestinal malignancies, pediatric tumors, fetal-infant pathological postmortems, and thyroid cytology reporting, valuable resources for many professionals. Beyond her professional life, Professor Amaratunga enjoys traveling and music. She is married to Dr. Ajit Premalal, a medical officer in the Ministry of Health, and they are blessed with 2 children. Ravindu, who is studying electronics and telecommunications engineering at Moratuwa University, and Vasatya, who is studying at Musaeus College. Professor Amaratunga's journey from her early academic pursuits to her recent election reflects a deep commitment to the College of Pathologists of Sri Lanka. Her selection as the president in this landmark 50th anniversary year of the college is a testament to her quiet, determined dedication and the considerable esteem with which she is held by her peers. Her tenure as vice president in 2023 and president-elect in 2024 have prepared her for the responsibilities that lie ahead, which she is well able to accomplish. Anyone who has ever worked with Professor Amaratunga in any capacity knows her quiet efficiency, extraordinary work ethic, and tremendous capacity, and her incredible ability to bring out the best in those with whom she works with. In all these while, maintaining a calm and unflustered disposition. I'm sure you will all agree that it is this combination of factors which always ensure the excellent outcome in everything she sets her mind to. We are confident that under her guidance, the College of Pathologists of Sri Lanka will continue to thrive, fostering excellence in practice, research, and education. Ladies and gentlemen, it is with immense pride and pleasure that I now formally induct Professor Priyani Amaratunga as the President of the College of Pathologists of Sri Lanka for the year 2025.
Dr. Priyanka Begunasekara will now present the President's Medal to the President for the year 2025, Professor Priyani Amaratunga. Thank you, Madam. I now invite Professor Priyani Amaratunga, President for the year 2025, to deliver the Presidential Address.
Professor Neelakanthi Ratnatunga, Professor Emeritus, University of Peradeniya, our chief guest today. Professor Chandra De Silva, former Chair and Senior Professor of Pathology, University of Colombo, our honored guest speaker. Past Presidents and Council members, the Dean of the Faculty of Medicine, University of Colombo, and former Deans. Distinguished invitees from professional colleges, the Ministry of Health and universities, members of the college, postgraduate trainees, those who are here and also joining online, and ladies and gentlemen. It is with great pleasure and pride that I accept the responsibility of leading this esteemed college, especially in this remarkable year as we celebrate its Golden Jubilee. I recognize the significance of this role, and I am deeply grateful to the past presidents, the council members, for placing their trust and confidence in me. Our theme for this celebratory year is commemorating the past, excelling in the present, and aspiring for the future. Today in my speech, I would reflect on the present, and I would like to focus on identifying the critical gaps we must address to achieve excellence now and to prepare for the future. Pathology is the study of disease, and as its name comes from Greek words, pathos means suffering and logia means study of. So the study of suffering is called pathology. We pathologists are doctors who have given up the stethoscope long time back, and whether we took over the microscope, test tubes, needles or syringes, or the analyzers, we all work to help patients in diagnosing and understanding the etiopathogenesis of diseases and their clinical effects, and guiding clinicians on treatment. Anatomical pathology or histopathology, as we all know, has undergone a paradigm shift the same way as the other specialties in the medical field. For centuries, the autopsy served as the cornerstone of our understanding of disease. Later, the diseases detected at advanced stages were resected and sent for pathological examination, remembering us the vast collection of resected specimens, the tangible evidence of advanced stage disease that filled our museums. With the development of clinical fields and advanced technologies in radiology, now the diseases are detected at early stages, and sometimes well before they become clinically evident. Pathologists are getting more and more small biopsies, sometimes microbiopsies, aspirated in aspirated material by minimally invasive methods. There are clear advantages in small biopsies. In addition, being less invasive to the patient, biopsies allow for earlier interventions and personalized medicine and tailored treatment plans. But this shift comes with its own sets of challenges. Limited tissue availability, sampling bias, and interpretation difficulties require meticulous attention to detail. Artifacts and pre-analytical errors can significantly impact the diagnostic accuracy. While the tissue sampling techniques are revolutionizing, the diagnostic tools used in histopathology are also revolutionized. From the diagnosis made based on gross description and routine histopathology, now immunohistochemistry or immunofluorescence has become essential test for the diagnosis. These facilities were initiated about 15 to 20 years ago in Sri Lanka and been available to any patient through national laboratories. Furthermore, we have stepped into molecular diagnostics, which has really transformed pathology by identification of biomarkers which are beyond morphology and providing deeper insights into disease mechanisms. This has paved the way for personalized medicine and targeted therapies, especially for cancer patients. Instead of radical surgeries, chemotherapy, and radiotherapy, which will damage all kinds of cells, cancer treatment nowadays is more personalized, and the drugs are given targeting exact molecules responsible for cancer progression. Patient care is a teamwork with multidisciplinary involvement, especially with regard to cancer patients. Surgeons, endoscopists, or radiologists are skilled and use sophisticated and costly equipment to obtain the best possible biopsy sample for the pathologist to diagnose. The pathologists use their knowledge and expertise and perform best possible costly investigations such as immunohistochemistry to arrive at a precise diagnosis. Also identifying prognostic and therapeutic markers that will guide the oncologist to give targeted therapy. The oncologist will look for more factors that will affect the prognosis of the patient and will put the patient on the best possible personalized treatment regime. The administrators are in forefront, providing facilities, the equipment, chemicals, and medicines for all categories of specialties. So our setup is perfect. Are these facilities provided in parallel and equally? There is no point endoscopists performing advanced procedures and obtaining biopsies if the pathologist does not have required reagents to do necessary tests. And similarly, no point pathologists performing all costly specialized investigations to identify biomarkers if the oncologists do not have medicines for targeted therapy. Even if the facilities are provided, whether they are provided on time or whether those are in standard conditions also matters, such as temperature monitoring for immunohistochemistry reagents. The specimens taken by the surgeons does not directly reach the pathologist in our setting. There is a long process between the surgeon and the pathologist, with multiple critical steps that are unsupervised and can impact laboratory diagnosis. Even when the surgeons obtain an optimal specimen, several pre-analytical factors influence its integrity. These include the factors related to fixation, the containers used, and the transport conditions. Any deficiencies in these steps can compromise specimen integrity, particularly affecting immunohistochemistry and molecular assays. Errors in this pre-analytical phase often lead to inconclusive test results, necessitating the repetition of costly investigations. This not only increases the financial burden, but also poses challenges in result interpretation. Histopathology is a unique laboratory discipline where, unlike in other specialties, many variables are subjective. Whether performed through conventional microscopy, digital pathology, or AI-assisted tools, diagnosis relies on morphological interpretation, the appearance of tissues and cells. As a result, histopathological analysis is susceptible to observer bias, inter-observer variability, and interpretative errors. These challenges are often attributed to sampling issues and technical inconsistencies, which can significantly impact diagnostic accuracy. Histopathological interpretation relies on patterns, colors, textures, size and shape variations, cell counts, measurements, and numerous other factors. However, these critical diagnostic elements can be significantly compromised by improper tissue fixation and processing, directly impacting accuracy and reliability. Immunohistochemistry requires both high specificity and sensitivity, having the precise intensity of staining, the exact location of staining, whether on the cell membrane, nucleus, or the cytoplasm. The accuracy of these results is heavily dependent on proper tissue fixation and processing. Otherwise, it will lead to false negative results where important biomarkers go undetected. Such errors not only compromise diagnostic accuracy, but also result in wastage of costly reagents and, more importantly, may prevent patients from receiving the most appropriate treatment. For those who are not pathologists in the audience, this AI-generated graphic illustrates the difficulties the pathologists face when interpreting histopathology. If the image on the left represents the textbook appearance of a particular tumor, particular cancer, and a patient's biopsy sample looks like image A on the right, the diagnosis is relatively straightforward. However, some cancers are poorly differentiated, as seen in image B, or completely anaplastic with no recognizable differentiation, as shown in image C. In such instances, diagnosis becomes significantly challenging, requiring meticulous examination, second opinions, and the use of a panel of immunohistochemical markers. Beyond these inherent complexities, poor tissue fixation, poor tissue quality, illustrated in image D, further complicates interpretation. Factors such as crush artifacts, inadequate fixation, and improper processing can severely compromise tissue integrity. Under such conditions, even with advanced and costly tests like immunohistochemistry, interpretation remains difficult, even for the most experienced pathologist. Our theme for the 50th anniversary celebration is commemorating the past, excelling in the present, and aspiring for the future. As we look for the future, our aspirations include advancing molecular pathology, embracing digital pathology, and integrating AI-driven tools into our practice. However, to move forward effectively, we must first identify and address the critical gaps that exist in our current processes. Excellence in the present requires a commitment to refining and strengthening these foundations, ensuring we are well prepared to embrace the next era of diagnostic pathology. The national guidelines for the collection, handling, and transport of surgical specimens were published by the Ministry of Health and the College of Pathologists of Sri Lanka in 2021. However, many of its recommendations have yet to be fully implemented, and now it is high time that we actively implement these guidelines. For instance, the guidelines clearly specify that small biopsies often obtained through costly procedures should be transported in secure, properly sealed containers as shown in the top image. Despite this, we continue to receive specimens in inappropriate containers, such as empty penicillin bottles, where loose lids result in formalin spills and potential specimen loss during transport to the laboratory. This year, the College will prioritize elevating the quality of laboratory services. To achieve this, I require the full support of the College, the clinicians, and the administrators of the Ministry of Health. Strict adherence to guidelines and standard operating procedures is essential. Furthermore, effective multidisciplinary collaboration is non-negotiable. We must address current gaps by fostering a culture of collective responsibility where clinicians, radiologists, pathologists, and administrators work together to ensure process excellence. Looking ahead, the future of pathology is bright. Artificial intelligence and machine learning tools offer the potential to enhance diagnostic accuracy and efficiency. The role of the pathologist is evolving. We are no longer simple diagnostic experts. We are consultants and collaborators working closely with clinicians to tailor treatment plans based on individual needs. The AI revolution is upon us, bringing both challenges and opportunities. The critical question is Sri Lanka prepared? To ensure we must embrace these advancements with a proactive and strategic approach. Before concluding my speech, I would extend my heartfelt thanks to Professor Neelakanthi Ratnatunga for graciously accepting my invitation as the chief guest. Madam, your presence here had added a great honor to this event. My heartfelt gratitude also goes to Professor Chandra De Silva for accepting to deliver the 50th anniversary lecture. Sir, thank you very much, and we are waiting to hear an insightful and inspiring lecture from you today. I would also like to acknowledge the senior pathologists and the past presidents of the college whose tireless efforts have shaped this institution in such a way that we can proudly celebrate its golden jubilee this year. A special note of appreciation to the previous council, led by Dr. Priyanka Abegunasekara, for your support given without any hesitation in initiating this year's work, and for sharing your invaluable experience. To the present council, your dedication and collaborative spirit have been truly inspiring. Thank you very much for each and every one for your continuous support. I especially thank Dr. Lalani Jayamali De Silva, my co-secretary, as no one else will formally appreciate her work today, as she will be the one who will be proposing the vote of thanks. Your tireless efforts and meticulous attention to detail have been instrumental in the success of this event. You deserve immense recognition in your dedication. I am immensely proud of the entire staff of the Department of Pathology, University of Colombo, which is my second home. Your dedication and commitment to excellence make my role as the head of the department a truly rewarding experience. The immense support given by you during my busy schedules these days has made the department run without any interruption. I am very much grateful for that. This evening marks a significant milestone in my academic and professional journey, being inducted as the President of the College of Pathologists of Sri Lanka. But this journey and my success is not a solitary achievement. It is the culmination of the unwavering support, guidance, and encouragement of countless individuals. Today, I am so glad that I got the opportunity to pay my gratitude to all of them in one place. And let me mention some very special people in my life. First and foremost, I must express my deepest appreciation to my beloved parents. They nurtured my dreams and provided me with the strength to pursue my passions. My father is no more now, but my mother is still living in her 90s. Though she is unable to attend this event physically, I remember their unconditional love and support that have been the strength in my life. Being the youngest in my family, I was blessed with 2 elder brothers and a sister. I am so glad that they are here today. And thank you very much for always being there for my help, especially during times when our parents face difficulties. Your solidarity has been a constant source of strength. I have a few friends of my school days and faculty days whom I cannot forget. Their moral support since childhood and young age has been an immense help for my progression. Also, I cannot forget the unwavering support given by a couple of neighbors, Ms. Mala and Mr. Mahinda, especially caring for my children when I am busy as their own kids. I am very much grateful to the free education in this country. As much as I remember St. Paul's Milagiri Girls' School, where I received my secondary education, I also pay my gratitude to 2 schools where I received my primary education, Olaboduwa Soisa Mahavidyalaya and Kasbawa Dharmasenatikala Balika Vidyalaya. I am eternally grateful to my teachers who instilled in me a love for learning and commitment to excellence. My journey continued at the Faculty of Medicine, University of Colombo. I am deeply indebted to the esteemed faculty members who shaped my medical education. I am particularly honored to have Professor L.R. Amarasekara, Professor Jennifer Pereira, Professor Chandra De Silva, Professor D.J. Anthony, and other senior professors present here today. Your guidance and mentorship has been invaluable. The comprehensive training I received during my postgraduate studies was instrumental in my career as a pathologist. I owe immense gratitude to my histopathology trainers, Dr. Ruchira Fernando and Dr. Abe Ile Peruma. I am so glad that both of you are here today. The perfect blend of tough training by the madam and the more gentle and compassionate approach of the sir has kept unforgettable memories in my mind, and the same in many other trainees of you in the audience. During my diploma in pathology training, I was fortunate to work under 3 pillars in respective specialties. Dr. Mala Tudave is here today. Thank you very much, madam, not only for your exceptional training, but also for your unwavering support during my personal health challenges. I take a moment to remember late Dr. S.D. Athukorala for his concern to my training, especially during my difficult times, in addition to his exceptional qualities as a supervisor. Dr. Saroja Sirivardhana was the chemical pathology supervisor for many of us, and I thank her for the guidance and expertise shared with us. I have received specialized training also from Professor Neelakanthi Ratnatunga on renal pathology, from Professor Chandra De Silva on perinatal pathology, from Professor Janaki Heva Vicente and Dr. Janaki Fernando on GI and gynae pathology, some of which are my interested subspecialties now. Thank you very much, madams and sir. After joining the University of Colombo, I was incredibly fortunate to have worked alongside and been mentored by such esteemed seniors, Professor Chandra De Silva. Your constant guidance and unwavering belief in me have been pivotal to my success. Professor Niranthi Pereira, your meticulous attention to detail has helped me refine my work. Professor Dilani Lokuhetti, from whom I learned methodical approach to work, and also Professor Lalindra Gunaratna for always being in my support when needed. I also take a moment to remember late Professor Preetika Agunawala today. I also extend my gratitude to the senior professors at the Faculty of Medicine, Colombo, with whom I had the privilege of working closely. Former Dean, Professor Jennifer Pereira, for your leadership and support and the confidence built on me. Current Dean, Professor Vajira Disanayaka, for your continued guidance. Professor Saroj Jayasinghe and other professors with whom I have worked closely for curriculum and research activities. Finally, and most importantly, I need to express my deepest gratitude to three very special people. My husband, Ajit. 35 years ago, we began this journey together. Through thick and thin, you have been my unwavering support. Your daily acts of love and sacrifice have made my pathway clearer and helped me immensely. My son, Ravindu, and my daughter, Vasatya, I know there were many boring hours spent by you waiting for your mom to finish work. I tried my best to be with you, and I hope you know how much I cherish you. I may have missed some important school and life events of you, but I have always been there in spirit. Thank you everyone for being part of this special evening. I am truly humbled and honored to serve as the President of the College of Pathologists of Sri Lanka for 2025. I look forward to working with all of you to achieve the field of pathology, to advance the field of pathology and serve our community. Thank you.
Thank you, Madam. I now invite Professor Priyani Amarathunga to present the past President's Medal to Dr. Priyanka Abegunasekara as a token of our appreciation for her dedication and commitment to the College of Pathologists of Sri Lanka and the significant contributions to the field of pathology over the past year.
Thank you, Madam. The Fellowship of the College of Pathologists of Sri Lanka is awarded to members of the College in recognition of their contribution to uplifting the field of pathology in the country. This year, the Fellowship will be awarded to 3 consultant histopathologists. The Fellowship will now be awarded to Professor Roshita Vaduge, Professor in Pathology, Department of Pathology, Faculty of Medicine, University of Peradeniya. The citation will be read by Dr. Shereen Susay.
It is with immense pleasure that I deliver this citation for the conferment of the Fellowship of the College of Pathologists of Sri Lanka 2025 and on this 50th anniversary celebration. Roshita Nilmini Vaduge was born in 1964 as the eldest in a family of 3. She received her education at Mahamaya Girls College, Kandy, excelling both academically and in extracurricular activities. She is a highly esteemed pathologist who has dedicated her life to medicine as a clinician, a researcher, and a teacher. Growing up in a home where education was a prized pursuit, she entered North Colombo Medical College, Ragama, and qualified as a doctor in 1992 with second-class honors. Her early medical career was spent serving at Base Hospital Navalapitiya, Anuradhapura, and Teaching Hospital Kandy as a resident house officer in hematology, the outpatient department, and the ETU, earning appreciation from patients and consultants. In 2002, she obtained her MD in histopathology from the University of Colombo, securing first place in the merit order. She pursued overseas training at Royal Prince Alfred Hospital, Sydney, Australia. During this time, she had the rare opportunity to train under Professor Clive Harper, a renowned neuropathologist at the University of Sydney. Specializing in muscle biopsy interpretation, and upon returning to Sri Lanka, she pioneered the establishment of this service alongside her mentor, Professor Neelakanthi Ratnatunga. After completing the requirements for board certification, she was appointed consultant pathologist at General Hospital Anuradhapura, where she managed histopathology, cytopathology, and hematology services under a heavy workload. Her passion for teaching and training led her to join the Department of Pathology, Faculty of Medicine, University of Peradeniya in 2006. Professor Vaduge's dedication to both undergraduate and postgraduate pathology education is unparalleled. She has mentored numerous young pathologists, many of whom are now serving actively both locally and internationally. A true mentor, she ensured that each of her trainees presents at least one abstract under her guidance. Over the years, she has been a respected examiner for MD pathology, MD surgery, and obstetrics and gynecology, and emergency medicine examinations. She has also served as the Secretary of the Board of Study in Pathology, Postgraduate Institute of Medicine, University of Colombo, and the Postgraduate Medical Sciences Unit at Peradeniya. Additionally, she held the position of Head of the Department of Pathology for 3 years of the University of Peradeniya and was appointed professor in 2019. With a passion for research, Professor Vaduge has published over 27 peer-reviewed and indexed journal articles. Her work has been recognized with prestigious awards, including the President's Award for Scientific Research in the year 2015, and the Best Paper Award from the Candy Society of Medicine in 2014. In recognition of her contributions to diagnostic approach to muscle disorders, she was nominated as a coordinator alongside 2 others by the College of Neurologists of Sri Lanka. She represented the Australasian Myology Centre focal point in Peradeniya in 2018. She is a talented musician and proficient in playing sitar and piano accordion. Despite her demanding professional life, her family remains her greatest priority. She is married to Nihal, a world rugby educator, and they are proud parents to Nilupuli and Hastika, both of whom have followed in her footsteps and are now junior doctors. Ladies and gentlemen, on behalf of the College of Pathologists and the President and the Council of the College of Pathologists of Sri Lanka, it is my great pleasure and honor to present Professor Roshita Nilmini Vaduge for conferment of the Fellowship of the College of Pathologists of Sri Lanka for the year 2025.
The next fellowship will be awarded to Dr. Shanika Fernandes-Pulle, Consultant Histopathologist, North Colombo Teaching Hospital, Ragama. The citation will be read by Dr. Prabodha Samararatna.
It is with immense pleasure that I deliver this citation for conferment of the Fellowship of the College of Pathologists of Sri Lanka 2025. Shanika Madonna Fernandopulle was born in January 1965 in Negombo and had her education at the Ave Maria Convent, Negombo. She entered the Faculty of Medicine, Colombo, in year 1985 and graduated from the Faculty of Medicine, University of Colombo in 1992. She completed her internship at Negombo Base Hospital under the supervision of Dr. D.S. De Silva and Dr. D.M. Jayasinghe. After the internship, she served at the Negombo District Hospital under Dr. Siromi Pereira, who encouraged and supported her to enter the field of pathology. In 1997, she entered the postgraduate training course for pathology of the Postgraduate Institute of Medicine and was attached to National Hospital of Colombo. After obtaining the diploma in pathology in 2000, she entered MD course in histopathology at the National Hospital Colombo under the guidance of Dr. Ruchira Fernando and Dr. Abeile Perume. She completed the MD histopathology in 2002. Dr. Fernando Pulle completed her post-MD training at Singapore General Hospital under the guidance of Tan Pua Hoon and Prof. Ivison and was board certified as a consultant in pathology, histopathology in 2004. She started her career as a consultant histopathologist at the District General Hospital, Chilao, and then moved to District General Hospital, Kalutara and Negombo. She currently works at the North Colombo Teaching Hospital, Ragama, as a consultant histopathologist. Over the years, Dr. Fernando Pulle has contributed to the development of pathology in Sri Lanka in many ways. She has been a coordinator for the international conference on 2 occasions in the year 2011 and 2013. She held the post of President College of Pathologists of Sri Lanka in 2020 during the peak of corona epidemic. She has been a council member of the College of Pathologists of Sri Lanka intermittently from 2010 to 2021 and is a life member of the college. She is one of the senior trainers in histopathology of the Ragama Training Cluster, one of the largest training centers in Sri Lanka. She has been a postgraduate examiner for the MD histopathology examinations, including MD Part 1 and MD Part 2. She has also been an undergraduate examiner for the Department of Pathology, University of Ruhuna for many years. She has also served as a member of Board of Study in Pathology, Postgraduate Institute of Medicine, University of Colombo. Dr. Fernando Pulle has trained many batches of medical laboratory technologists at MLT School of Kothalawala Defence Academy and participated as an examiner in MLT examinations for many years. She has also trained postgraduate trainees in other specialties attached to North Colombo Teaching Hospital, including trainees in family medicine, rheumatology, respiratory medicine, and dermatology. Ladies and gentlemen, on behalf of the President and the Council of College of Pathologists of Sri Lanka, it is my great pleasure and honor to present Dr. Shanika Madonna Fernandopulle for conferment of the Fellowship of the College of Pathologists of Sri Lanka 2025.
The next fellowship recipient is Professor Dulani Beneragama, Consultant Histopathologist, Faculty of Medical Sciences, University of Sri Jayawardenepura. The citation will be read by Dr. Avanti Rajapaksa.
Good evening to everyone. It is my privilege to deliver this citation for Professor Dulani Benragama for conferment of the Fellowship of the College of Pathologists of Sri Lanka for the year 2025. Dulani Hasanthi Benaragama received her primary education at Visakha Vidyalaya, Colombo, and completed her undergraduate education at the Faculty of Medicine, University of Colombo, where she graduated with second-class honours. After her internship at the National Hospital of Sri Lanka, she chose pathology as her specialty and underwent initial training under Dr. Ruchira Fernando at the National Hospital. Thereafter, she joined the Faculty of Medical Sciences, University of Sri Jayawardenepura in 2001 as a probationary lecturer. She continued her pathology training at Colombo South Teaching Hospital under Dr. Kumudini Vasalarachi and obtained her MD in pathology in 2003. She completed her overseas training at Royal Adelaide Hospital, Australia, and became a board-certified consultant histopathologist in 2005. Since then, she has provided honorary consultancy to the professorial units of the Colombo South Teaching Hospital. Her teaching career at the Faculty of Medical Sciences, University of Sri Jayawardenepura, spans a period of 24 years. She was promoted to senior lecturer in 2005, to associate professor in 2019, and served as the head of the Department of Pathology from 2016 to 2018. Her passion for teaching has earned her awards for teaching excellence. She has served as an examiner for undergraduate MBBS and Bachelor of Science degrees in human biology, medical laboratory sciences, nursing, and pharmacy. She has also acted in the capacity of an external examiner for other medical faculties. Professor Dulani has served as a postgraduate examiner for selection and MD examinations in pathology, and is also a sought-after examiner for other specialties, including surgery, dental and OMF surgery, forensic and legal medicine, and gynecology and obstetrics at the Postgraduate Institute of Medicine, University of Colombo. A valued member of several academic boards, she has contributed to the boards of study in pathology and forensic medicine at the Postgraduate Institute of Medicine, Colombo, and at the Faculty of Graduate Studies at the University of Sri Jayawardenepura. Additionally, she was the MCQ Core Group Coordinator from 2017 to 2020 and the Research Day Coordinator for the Board of Study in Pathology from 2016 to 2020. She has also been a resource person at various conferences and workshops. Her research presentations have won awards at local conferences, and she has publications in prestigious local and international peer-reviewed journals. She has supervised numerous research projects at both undergraduate and postgraduate levels and has authored and co-edited several book chapters and the national guidelines. Professor Dulani has also served as a reviewer for the Journal of Diagnostic Pathology and the Journal of Surgery. She was also a member of the Ethics Review Committee of the University of Sri Jayawardenepura from 2010 to 2016. Professor Benragama has been an active member of the College of Pathologists of Sri Lanka since 2006. She was the secretary of the inaugural International Conference, or the ICON, organized by the College in collaboration with the British Division of the International Academy of Pathology, or the BDIAP, in 2007. As co-editor of the Journal of Diagnostic Pathology from 2013 to 2016, she was instrumental in transitioning the journal from an annual to a biannual publication. She is currently also a member of the editorial board. Appointed president-elect in 2020, she assumed the presidency in 2021 during the challenging COVID-19 pandemic. Under her leadership, she successfully transitioned the college's activities to the virtual platform, ensuring the continuity of key events, including the presidential induction, academic sessions, webinars, and workshops. She played a key role in conducting workshops in collaboration with the Sri Lanka Accreditation Board to train selected government sector laboratories for accreditation and in overseeing the completion and the publication of critical national guidelines, as well as compiling guidelines for lab design and waste disposal. Additionally, she initiated the development of a CPD marking scheme and led a quality assurance program to assess proficiency of pathologists. As someone who has had the honor of receiving her guidance for my training in MD in histopathology, I can personally attest to Professor Dulani's dedication, expertise in her field, and passion for histopathology. Madam, your wisdom and unwavering commitment have left a lasting impact on not only myself, but also on countless trainees who have come into your fold. This achievement is a testament to your hard work and commitment, and I have no doubt you will continue to make a lasting impact in the field of histopathology. Ladies and gentlemen, on behalf of the President and the Council of the College of Pathologists of Sri Lanka, I am privileged to present Dulani Hasanti Benragama for conferment of Fellowship of the College of Pathologists of Sri Lanka for the year 2025.
The College of Pathologists of Sri Lanka was founded in 1975 by a handful of pathologists with a collective vision to improve services and quality of care in the entire nation. As we reflect on the college's rich history, we have much to celebrate. We are reminded of the unwavering commitment and dedication those who have worked hard over the last 5 decades to take our college from its modest beginnings to become the leading body representing the pathologists in our country. As we celebrate our 50th anniversary, we are honored and privileged today to have with us as our chief guest a pathologist who has dedicated her life in advancing the field of pathology in our country, a dedicated teacher, researcher, clinician, and a mentor to a generation of pathologists. I would like to invite Professor Priyani Amaratunga, President of the College of Pathologists of Sri Lanka for the year 2025, to introduce the chief guest for the evening. Professor Neelakanthi Ratnatunga, Emeritus Professor, University of Peradeniya.
Ladies and gentlemen, it is my privilege and honor to introduce the chief guest of the Presidential Induction and the 50th Anniversary Celebration of the College of Pathologists of Sri Lanka, Professor Neelakanthi Ratnatunga, Professor Emeritus, University of Peradeniya. Professor Ratnatunga graduated with honors and ranked first in her MBBS batch in 1978 and obtained a PhD from the University of Peradeniya in 1986, Diploma in Pathology from University of Colombo 1984, MD in Pathology from the University of Colombo in 1991, and board certified as a consultant histopathologist in 1992. Her academic excellence is further underscored by her honorary fellowships from the Royal College of Physicians of Edinburgh, the College of Pathologists of Sri Lanka, and the Sri Lanka College of Surgeons. Her academic journey at the University of Peradeniya is marked by consistent advancements from lecturer in 1980, Professor of Pathology from 2000 to 2019, to Senior Professor of Pathology from 2007 to 2019. She served as head of the Department of Pathology from 1993 to 2011, demonstrating her strong leadership. Currently, she holds the distinguished position of Professor Emeritus, University of Peradeniya. Professor Ratnatunga is a recipient of Commonwealth Medical Fellowship and Senior Commonwealth Fellowship, which enabled her to pursue a specialized training in immunohistochemistry techniques related to renal disease at St. Thomas's Hospital, London in 1998 to 1999, and histochemistry and immunohistochemistry relating to muscle disease at Hammersmith Hospital, London in 2007 to 2009, respectively. She has taught undergraduate and postgraduate students for the past 38 years. Her commitment to education is evident in her role as a visiting lecturer at the Faculty of Dental Sciences, University of Peradeniya, and as a trainer for Diploma and MD Pathology and Histopathology of the Postgraduate Institute of Medicine. Professor Ratnatunga's scholarly achievements are reflected in her H index of 27 and her numerous awards, including President's Research Bonus, National Science Foundation of Sri Lanka Award, NRC Merit Award, and President's Award for Scientific Research. Her research contributions are substantial, with groundbreaking work on diaphorelia repens, IgA nephropathy, and breast carcinoma hormone receptor profiles in Sri Lankans. Her supervision of MPhil and PhD students has significantly advanced our understanding of chronic kidney disease of unknown etiology. She has served as editor-in-chief for Journal of Diagnostic Pathology and served in the editorial boards for Ceylon Journal of Science and Sri Lanka Journal of Medicine. Professor Ratnatunga's contributions extend beyond academia. She served as the director of the laboratory at the Teaching Hospital Peradeniya. During her tenure, she pioneered the introduction of immunohistochemistry, renal histopathology and immunofluorescence, and muscle histochemistry and immunohistochemistry laboratories at the University of Peradeniya. These facilities, the first of kind in Sri Lanka, has benefited many hospitals and transplant and dialysis units across the country. Her dedication to patient care is exemplified by her continuous reporting of renal biopsies for numerous hospitals. On a personal note, I also have learned my ABC of renal pathology from Professor Ratnatunga, finally which became my most interesting field. Her influence in professional bodies is equally profound and has served as the president of the College of Pathologists of Sri Lanka in 2001, the Kennedy Society of Medicine in 2015, and the Peradeniya Medical School Alumni Association in 2011 to 12. Professor Emeritus Neelakantha Ratnatunga's extraordinary career, marked by pioneering contributions to pathology, unwavering dedication to patient care, and a profound commitment to education, has left an indelible mark on Sri Lanka's medical landscape. We are deeply honored to have her as our chief guest today. Please join me in extending a warm welcome as I invite Professor Neelakantha Ratnatunga to the podium.
The President and Council of the College of Pathologists of Sri Lanka, members of the head table, distinguished invitees, ladies and gentlemen. To be invited as the chief guest at this historic event of the college is indeed a singular honor. I am actually overwhelmed by this gesture, and I thank the Council for this invitation. Thank you ever so much for the gracious and warm welcome afforded to me this evening. As always, it was good meeting many colleagues and friends, bringing back nostalgic memories of yesteryear. Priyani, firstly, congratulations to you on your election as president of the college in a challenging year. I'm sure your steadfast, able guidance will enable you and your committee to achieve the aspirations outlined in your inspiring address. I am deeply touched by the elegance of your citation read out for me. Thank you very much indeed. I extend my congratulations to all those who have conferred the honorary fellowship of the college, an honor which you all richly deserve. The theme for this golden anniversary is commemorating the past, excelling in the present, and aspiring for the future. Priyani and Priyanka, what a beautiful theme this is. I congratulate you all for thinking of these words, or should I say sentiments. Simple, yet eloquent, expressive, and so inclusive. Professor Chandu De Silva, I'm sure, will narrate the remarkable journey of this college in his own unique style, paying tribute to all those individuals who initiated and made this college. I look forward to listening to you, Chandu, on the final diagnosis of 50-year odyssey. These past pioneers were not just clever pathologists. They all had this exceptional attribute which endeared us to them, a common thread. And for me, it was their genuine interest in the welfare of the younger pathologists that stood out. I remember the late Professor Alf Panabokke, who, as he said in his own words, would rack his brains the whole night, trying to think of an answer to a problem, be it administrative, academic, or personal. The late Dr. S.D. Attakorale, microbiologist, a former secretary to the Board of Study in Pathology at the PGI many years ago, a man with a dry sense of humor, I must say, had all the details about all the trainees in all specialties at his fingertips. You see, he had this file, which had a half sheet for each trainee with all the relevant information written on it. Dr. Rani Pereira, I think she is the most senior pathologist now, was the very first coordinator of the PAT training program of the PGIM. I remember myself being one of those first trainees, how very interested she was in our welfare and keeping a watchful eye on us. We wish her well. I'm so happy to see in the audience Professor Ella Ramanasekara. Sir, you are an inspiration, an example to us all by your presence and participation in all events of the college. Personally, like many others here, I remember with gratitude your strong, unobtrusive support to us, younger members of the Board of Study, when we had to take on responsibilities of being chief examiners, etc. Thank you so much, sir. Now, I cannot forget the remarkable past directors of the PGIM who were very supportive of our college activities. They sort of, did not mind when we used the beautiful old wood panel boardroom in the PGIM for our monthly college meetings, which usually followed the Board of Study meeting. So naturally, refreshments were automatically looked after. As spoken by our president, I am amazed at the great strides made by the college in many aspects due to the remarkable efforts of the past presidents and all the pathologists and training pathologists who supported them. I was privileged to participate in the college sessions virtually in the recent past and was struck by the efficiency and professionalism of our members. Congratulations, Priyanka, and your team for this organization, and also a tremendously successful year during your tenure as president. The practice of medicine in Sri Lanka is now very specialized. With highly trained clinical specialists being available countrywide, the demands on the pathologists have increased, as the president told us. Comprehensive reports are expected and is the norm. Immunohistochemistry, molecular testing, flow cytometry are now routine. Turnaround time for reports is the fashionable jargon, the Western standards. Our pathologists have kept up with modern trends, giving a service on par with international standards to our patients and support to our clinical colleagues. Now, this level of pathology is expected from those young people working in peripheral hospitals also. All this is in the background scenario of the Sri Lankan social ethos of family and social commitments. In keeping with the theme Aspiring for the Future, I will briefly express my thoughts on the future of our laboratory services, a safe and happy place for young pathologists. With the increase in the brain drain of trained pathologists, those awaiting their overseas training are assigned as acting consultants to peripheral hospitals. Some have to even cover several hospitals, traveling long distances. They may have to clear backlogs. They depend on the bigger centers for all the sophisticated tests for their reports. Yes, facilities in national hospitals and specialized hospitals are available to them, but understandably there are delays. Senior colleagues to get advice or second opinion are far away. This is a worrisome situation. Pressure on them to issue quick reports can be quite demanding and sometimes unsafe. There is also now a demand for specialized opinions in areas we are not trained to deal with, where even we as senior pathologists do not have the training or expertise. There is no room for learning curves here. These facts are deterrents to those having to return back to Sri Lanka after overseas training, because they know they will be faced with the same scenarios when appointed as consultants in the peripheries. We are in competition with the world in attracting our pathologists to return to Sri Lanka to serve in our labs. Clearly, we have to develop a novel marketing strategy to attract them. A radical change in the present system is demanded. Can we offer them a place of work where there will be little traveling to and fro to faraway hospitals, where the family can be together, where the children will be afforded a good education in a good school, where working from home is permitted, even working from abroad is permitted, where they can develop special interests, where private practice is also enabled? Yes, I think all this is eminently possible. Can we have them working in a centralized regional laboratory hub with all facilities? Yes, we can. Can university laboratories be harnessed to these hubs? I think so. Telepathology, digital pathology, artificial intelligence, in laboratory practice, this is possible. Many years ago, an eminent lady entrepreneur who had a very successful finance company was explaining to me how she ran her company and about her clients. She ended by saying, "They are happy, we are happy." This, I think, may be the answer to address the problems envisaged in our laboratories in the future. The administrators at the highest level should be enlightened, and I think the college could play the lead role in this regard. We have a very competent president this year, and I'm sure she and her team will be able to advise the relevant authorities on these issues. Priyani, I thank you once again for inviting me as the chief guest today. I wish you and your team a successful tenure, and I pledge my support to the college in whatever way I can. Thank you.
Thank you, Madam. I would now like to invite Professor Priyani Amaratunga to present a token of appreciation to the chief guest for the evening, Professor Neelakanthi Ratnatunga.
Thank you, Madam. The study of pathology plays a pivotal role in unraveling the mysteries behind diseases, thereby contributing to accurate diagnosis and development of effective treatment strategies to improve patient outcomes. As all pathologists here would agree, it's ever evolving, quite challenging, but never boring. 50 years ago, the College of Pathologists was founded with a mission to advance knowledge, enhance patient care, and create a space for pathologists to collaborate, grow, and learn. Our guest speaker today will reflect on that 50-year odyssey of supporting pathologists in the country to reach that final diagnosis that is so important in the care of our patients. It is with great pleasure that I invite Professor Priyani Amaratunga, President of the College of Pathologists of Sri Lanka for the year 2025, to introduce the guest speaker for the 50th anniversary lecture, Professor Chandu De Silva, former Chair and Senior Professor of Pathology, Faculty of Medicine, University of Colombo.
Ladies and gentlemen, it is my privilege and honor to introduce the guest speaker today, Professor Chandu De Silva, former Chair and Senior Professor of Pathology of the Faculty of Medicine, University of Colombo. Professor De Silva graduated in 1983 from the Faculty of Medicine, University of Colombo, where he ranked first in the final common merit list across all medical faculties in Sri Lanka. His remarkable academic excellence earned him gold medals in pathology and clinical medicine, along with distinctions in 6 subjects. With an illustrious career spanning 29 years as a consultant pathologist, Professor De Silva holds the distinction of being the longest-serving cadre chair in pathology at the Faculty of Medicine, Colombo, until he retired in November 2024. He also served as Professor of Pathology at Sultan Qobus University, Oman, for 2 years. Professor De Silva is a 2-time recipient of the prestigious Commonwealth Medical Fellowship, which enabled him to pursue specialized training in perinatal, fetal and pediatric pathology in Edinburgh in 1992 and soft tissue and bone pathology in Glasgow in 2002. He is a former president of the College of Pathologists of Sri Lanka and was also the founder editor of the Journal of Diagnostic Pathology, the official journal of the college. He has served as a council member on 14 occasions since 1998 and has been a trustee of the college since 2013. Additionally, Professor De Silva is a fellow of the College of Surgeons of Sri Lanka and has held council positions in multiple societies, including Perinatal Society of Sri Lanka, the Allergy and Immunology Society of Sri Lanka, and the Gastroenterological Society of Sri Lanka. His academic leadership extends to the Postgraduate Institute of Medicine, where he has served as chairperson of the Board of Study in Pathology and led the Curriculum Review Committee. He has also been a member of various boards, including those of dermatology, oral pathology, and forensic medicine. Over the years, Professor De Silva has trained more than 50 postgraduate trainees in pathology, supervised numerous MD research projects, and examined candidates for MD surgery, clinical oncology, dental surgery, oral pathology, and forensic medicine. With a research portfolio of over 260 published abstracts and 160 peer-reviewed publications, Professor De Silva work in soft tissue and bone pathology is frequently cited in academic textbooks. He has contributed to national healthcare guidelines as a co-editor for cancer and autopsy protocols, including bladder, prostate, and renal and thyroid cancers. His outstanding research has earned him 3 Presidential Research Awards, more than 30 research awards, and National Research Council Merit Award. His H-index is 19. As highly sought-after speaker, he has delivered over 115 guest lectures and plenary sessions at both national and international conferences. He has also had the honor of delivering the Professor G.H. Kure Oration. He is also the founder director of the Center for Diagnosis and Research in Cancer at the Faculty of Medicine, University of Colombo, which provides vital services to over 75 hospitals across 23 districts in Sri Lanka. On a personal note, Professor Chandra De Silva has been my teacher and mentor in pathology, and as he has been for many others in the audience. I also had the honor of working with him as a junior colleague in the same department for the last 17 years. Today, as we celebrate our 50th anniversary of the college, it is fitting that we hear from a leader who has witnessed and shaped the evolution of pathology in our country. We are privileged to have Professor Chandra De Silva deliver the 50th anniversary lecture, The Final Diagnosis, a 50-Year Odyssey. Please join me in warmly welcoming Professor Chandra De Silva to the podium.
Good evening, ladies and gentlemen. The year 1975. In the world stage, Vietnam, Laos, and Cambodia came under communist rule with the withdrawal of the American troops. It was also the year of the first Cricket World Cup, the year that Microsoft was launched, and on a dismal note, the year in which the mayor of Jaffna, Alfred Dureyappa, was assassinated by an organization which in the next year would call themselves the LTTE. Something else happened in 1975, something that would influence the lives of many pathologists. A group of visionary, dedicated Sri Lankan pathologists had the courage and commitment to launch the College of Pathologists of Sri Lanka. Professor Neelakanthi Ratnatunga, the chief guest, Professor Priyani Amaratunga, President, College of Pathologists of Sri Lanka. Ladies and gentlemen, it is my privilege to highlight some key events in this long 50 years in a brief period of 25 minutes. And I have termed the lecture, The Final Diagnosis, a 50-year-old Odyssey. Why the final diagnosis? Because we as pathologists have been entrusted the responsibility of making a diagnosis which will determine how a patient is to be treated and managed, which will have profound implications on the patient and the family. The word Odyssey is derived from the 3rd century BC poem by Homer called Odysseus, which describes the long and arduous journey back home in a ship after the 10-year-old Trojan War by Odysseus, the king of Ithaca. He had many unsurmountable obstacles during this journey, full of obstacles to overcome, and the trials of the tribulations of the College of Pathology has been no different. Thus, the talk is entitled, The Final Diagnosis, a 50-year-old Odyssey. It's the same term that we are going to use for a commemorative book which will come out this year together with the annual sessions of the college, edited by Prof. Isha Prematilaka, Prof. Janaki Heva Vicenti, Dr. Palitha Ratnayaka, with design and layout by creative designer Kitsiri Ekanayaka, who happens to be Isha's husband. The process of diagnostic pathology did not start with the College of Pathology. It existed and flourished before that. And it is up to us to preserve the memory of some great men who paved the way, who laid the foundation for the College of Pathology of Sri Lanka. Two names stand out during this pre-college era. The first is Dr. W.A. Karunaratne, who was appointed as pathologist, General Hospital, Colombo in 1936. In the same year, he was appointed as the first Ceylonese professor of pathology at the Colombo Medical School. He taught generations of undergraduates, but this did not deter him from coordinating the diagnostic laboratory services almost for the entire country for a long period of time. He was succeeded by his pupil, Professor Gerald Couret, who was appointed as Professor of Pathology in 1953. And this gentleman was the teacher of our teachers. And they called him an excellent teacher, an astute diagnostician, renowned researcher, and strict disciplinarian. My father also learned undergraduate pathology from Professor W.A. Karunaratne, and he described him as a very gentle, soft-spoken person who was scared to ask questions at the exam because he thought the students might not answer them. I have also heard about Professor Couret from very senior people who worked in our department, the non-academic staff, who called him a very strict disciplinarian. So how did the journey start? I believe that there were three protagonists, main players, Dr. Doris Pieris and Dr. Ranga Wickramasinghe, who were consultant pathologists at the General Hospital, Colombo, and Dr. Rani Pereira, who had just come back from foreign training and who was serving as the consultant pathologist at Eye Hospital, Colombo. And I believe that she was the main player in instigating the others to start the College of Pathologists of Sri Lanka. They met in a room, had an informal discussion, and decided to write a letter to all the pathologists in the country. And they met in the consultants' lounge of the General Hospital, Colombo. 18 pathologists were there. The constitution of the college was drafted and adopted at the same day, on that day, and Dr. W.D. Ratnavel was appointed as the president. Now, many of you may not know Dr. W.D. Ratnavel. I also have not come across him as such, but he was a visionary who started the Gas House, which was the best laboratory in the country, the private laboratory in the country at that time. He also went on to found the North Colombo Private Medical School. The secretaries, Dr. D.P.K.M. De Silva, was a consultant at Castle Street Hospital, and Dr. S.B. Ellapola, who was a hematologist, later became the professor of pathology at Peradeniya. Dr. Rani Pereira was the editor, and the council included some great names in the likes of Professor Daphne Artigala, Professor R.G. Panabokke, Dr. Doris Pieris, and another colossus in the field of pathology in this country, hematologist Dr. Nanda Prematilaka. In the early years, from 1978 to 1979, Professor G.E. Tendakon was the president. Actually, very little is mentioned about him in our college, but he started his career in the Colombo Medical Faculty and was transferred to Peradeniya when that faculty started. He became the head of department there, later the professor of pathology, and played a major role in the development of the University of Colombo. You heard about Dr. Doris Pieris. From 1983 to 1984, Prof. Daphne Artigala was the president, and at that time there were 31 life members and 9 ordinary members in the College of Pathology. Now, the College of Pathology has always played a very key role in the Postgraduate Institute of Medicine, because the college has had its representatives at the board. The Postgraduate Institute of Medicine was established in 1974. The Board of Study of Pathology was established in 1980, and Prof. Daphne Artigala was the first chairman of the Board of Study, and Dr. H.R. Wickramasinghe was the first secretary. And again in 1983, Prof. Daphne was elected or appointed as the chairperson of the board. Prof. Daphne succeeded Professor Kure as the professor of pathology. She was the first female professor of pathology. She also went on to become the first dean, the first female dean of any faculty in this country, and also acted as vice chancellor of the University of Colombo. The MD examination was very different those days. There was a Part 1 examination, which was first held in 1983, but this curriculum did not last for long because it was shortly changed to the Diploma in Pathology, which many of us sat for. The first Diploma in Pathology was held in November 1984, and one of the two people who passed was the then Dr. Neelakanthi Ratnatunga, who went on to do histopathology, and I think Dr. Nilanthi Ellavala went on to do hematology. The first academic sessions were held on 5th of July 1975. It just had one lecture on breast carcinoma by Prof. Ralph Panabokke and two case presentations by Dr. Nanda Prematilaka and Dr. S.B. Ellepola. A little bit about Dr. Nanda Prematilaka, who happens to be Isha Prematilaka's mother. She later founded the Sri Lanka College of Hematology. During this time, we did have international speakers speaking in Sri Lanka. One was Harold Fox, who did gynecological pathology, and all of you know about Ackermann's pathology. Prof. Lauren Ackermann was here speaking to the Sri Lankan audience. And that year, we also had a symposium on diagnosis of carcinomas at the Faculty of Medicine, Peradenium. Now, you might wonder, during this type of the voyage, what was the background sea like? What was pathology like in this country? It was a morphological diagnosis based on H&E and special stains. Although immunohistochemistry had been described by Coons in 1941, and the first antibodies were invented in 1975, immunohistochemistry was not in routine practice. And pathology reporting was very easy because they said mastectomy, invasive duct carcinoma of the breast. So trainees nowadays will think you all had it very easy because now we have to give a synoptic report which includes so many other factors. The period 1985 to 1994 was a very turbulent one for Sri Lanka. In 1983, the communal riots broke off, and after that, the LTT stepped up their terror activities. This was a time when there were bomb blasts in Colombo. Finally, there was the signing of an Indo-Sri Lankan Accord, and there was protest against this with an insurgency in the south. We all remember these days as days of darkness and horror, culminating in the assassination of the president of the country. It was in this background that the college continued to flourish and prosper, with Prof. Daphne Artigala as the president from 1985 to 1986, and Professor Ralph Panabokke from 1987 to 1992. In 1992, there were 56 members, college members. This is a photo of the Council of 1987. I have to mention some names here. That's Prof. Ralph Panebokke, Prof. Daphne Artigala, the three main protagonists that I talked to you about, Dr. Doris Piris, Dr. H.R. Wickramasinghe, and Dr. Rani Pereira. And our very own Professor L.R. Amarsekara is there, someone who we respect so much as our undergraduate and postgraduate teacher, someone who has been attending these annual sessions every year. There was also a very great teacher whom we admire so much, Dr. Chitrika De Silva, and this is Dr. B. Javira, who was the pathologist at Castle Street Cancer Hospital, Maharagama. He was considered as the ultimate diagnostician in Sri Lanka at that time. That is Dr. Professor Sisi Kanagaratnam, who was a biochemist, and therefore you can see that even at an early stage, there were biochemists and hematologists in our council. During this period, the College of Pathology obtained recognition as an approved charity. The college moved to the SLMA office at Vijay Rama House. There was the launching of the college journal and commencement of 3 orations. And the gentleman you see here is Professor H.V.J. Fernando, because at that time, the forensic pathologists were also members of the College of Pathology. The inaugural Professor G.H. Kure Memorial Oration was held on 5th February 1987 at the SLFI Auditorium. And Professor Christine Henry talked on role of immunohistochemistry in diagnostic histopathology. I was there in the audience. At that time, I had not decided to do pathology, although I was in the department. And I was wondering, what is this immunohistochemistry that she's talking about? And ignored the whole lecture, thinking that it was not going to play a major role in my life anyway, because I was going to do medicine. Since then, this oration has been given by other people as well. These are some pictures of the oration. That is Mrs. Sunetra Ranasinghe, who was the Minister of Teaching Hospitals and Women's Affairs, and Dr. Ranjit Atapattu, who was the Minister of Health. That's the audience with Dr. Rani Pereira there. That's Mrs. Renuka Ranasinghe, who was the Minister of Teaching Hospitals. She looks as if she has understood what immunohistochemistry is, unlike me, and I'm not sure what Prof. Daphne Artigala is trying to do there. The inaugural Professor Daphne Artigala unfortunately succumbed to cancer, and the inaugural Daphne Artigala oration was held on 18 November 1989. It was delivered by Professor R.G. Panebokke, who the topic was Glimpses of Masquerade as Seen by the Pathologist, where he described several difficult cases which he had diagnosed over the years. Since then, this oration has been delivered by Professor Preetika Angunawala, Professor Dilani Lokuhetti, Professor Janaki Heva Vicenti, and Prof. Lakmini Mudduwa. The inaugural Professor W.A. Karunaratna oration was also held in this period. Again, the orator was Professor R.G. Panebokke, and the topic was Ventures of the Sri Lankan Pathologists into the Realms of the Unknown, where he discussed research done by Professor W.A. Karunaratna and Professor G.H. Kure, and also talked about his own research. We all very fondly remember Professor Panebokke, who was a great teacher. Even after his retirement, he continues to teach postgraduate students. During this time, the Sri Lanka Journal of Pathology was also launched. You can see the tremendous role played by Dr. Rani Pereira, because she was the editor of the journal. The first journal had articles like the college, how it began, and that is from where I have obtained most of this information. It also had gleanings from the past, where Prof. Daphne Artigala talked about the pre-college era of the college. And a thing to note is that the young Dr. Neelakanthi Ratnatunga had an article in that journal describing her research in immunohistochemistry. There were 7 volumes in all, and they were all edited by Dr. Rani Pereira. The period 1994 to 2004 was not good news for Sri Lanka again. We had the bombings at the Bandaranayake International Airport, the Dalada Maligawa. The only respite was in 1996 when we won the World Cup. But then, towards the end of this era, nature struck havoc to cause the tsunami. But the college survived. From 1993 to 1996, there was a lull in the activities of the college. It went into a sleep mode or standby mode, and I think there were good reasons for this, because most of the senior pathologists had retired. Professor L.R. Amarasekara was abroad in his sabbatical, and the remaining handful were heavily involved in postgraduate teaching and examination. Professor Panabokka had been appointed as the director of the Postgraduate Institute of Medicine, and so his hands were full. But this was also the era that many newly qualified postgraduates obtained board certification as consultant pathologists. And they thought that the college had to be revived. I still remember the meeting which was held in the student lab of our department, where there was a little bit of resistance from the very senior pathologists who did not like the young people from taking on. But as a compromise, Dr. H.R. Wickramasinghe was elected as president. The annual academic sessions were held in 1997 at the Lionel Auditorium SLMA on 5th December 1997 after several years. And you can see the journal there, a very simple edition, because we did not have money to print anything better. And in 1998, we had to take a rest because we did not have enough money, enough funds to carry on. But from 1999, the college has always had its annual sessions. And in 1999, we had the annual sessions for the first time for 2 days. And those are the abstracts of those annual sessions. So in 1997 to 1998, Dr. H.R. Wickramasinghe was the president, and then we had Professor L.R. Amarasinghe, who has played a major role in the activities of the college. In 2000, we had late Professor Preetika Angunavala. Some of you will remember her as a great teacher. In 2001, Professor Neelakanthi Ratnatunga. And 2002, a chemical pathologist became the president of the college. And later on, she would go on to found the College of Chemical Pathologists of Sri Lanka. Dr. Anne Saparamadu still comes and gives lectures at our college sessions, and we all know Dr. Manala Joseph because she sings at the annual sessions. This, I thought, would please Neela because it's the year that she was the president, the council photo. I still remember this day because it was a nice day and we decided to take photographs in the garden. But the whole evening I was a bit confused because I could not decide which one of them looked the best. And the confusion still remains. The launching of the Journal of Diagnostic Pathology occurred in the year 2000. Again, some people wanted the name Sri Lanka Journal of Pathology to continue, but it had not been in print for some time, and we thought it should have a more international flavor, and therefore it was called the Journal of Diagnostic Pathology. And since then, there have been many illustrious pathologists who have served as the editor of the journal, with Dr. Harshima Vijayasinghe being the current one. Up to now, 18 volumes have been published. It was also during this time that a group of very enterprising and visionary hematologists decided that the College of Hematologists of Sri Lanka should be formed. And they, together with Dr. Nanda Prematilaka, formed the Sri Lanka College of Hematologists. And you can see Professor Arundhati Kulakulasuriya, Dr. Mala Tudave, Dr. Indira Vijayasirivardhana, that is Sudhanma Vidyatilaka, and this is Baddika Jayaratna. This, I think, is Dr. Tissa Pereira, Professor Tissa Pereira, and that's Dr. Nanda Prematilaka. In 2004, tsunami has struck. And next year I was the president, and I said we will not have induction of the president because so many people have died. And that tradition continued for a long time. That was the origin of how the induction of the president occurred with the annual academic sessions. We must also remember Professor Dilani Lokuhetti, of whom we are very proud because she happens to be the chief editor of the WHO Blue Book series right now. And all these presidents played a major role in the college activities. But one significant event that occurred during this period was the first international conference in 2007. Preparation for this actually started during Dr. Manela Joseph's time, continued into my time, and Prof. Dilani's. And the first conference was held in September 2007 at the Golface Hotel, Colombo, with Prof. Janaki Heva Vicenti and Prof. Dilani Lokuhetti as the co-chairs. And Prof. Isha Prematilaka was the coordinator. And since then, we have had 9 international conferences. The last one was a tremendous success under the leadership of Dr. Priyanka Abegunasekara. And you can see how the abstract books have improved tremendously over the years, and last year it was published online as well. During this period, a proposal was set up to set up the IHC laboratory, was presented to the college, and discussions were held with the Ministry of Health, and the National Immunohistochemistry Laboratory was completed in 2011. So just imagine, in 1987, Professor Christine Henry gives a talk on immunohistochemistry, and it took us this long to get the National Immunohistochemistry Lab going. We also started the award of fellowships, which you saw a couple of minutes ago, the launch of the college website, which was done again by Professor Christine Henry. Another significant thing was now pathology reporting had become very complex. A pathology report had to include so many details like whether vascular invasion was in there, perineural invasion, involvement of the surgical margins, etc., and synaptic reporting had come into play. And the publishing of national guidelines in histopathology by the College of Pathologists and MOH was funded by the Sri Lanka Health Sector Development Project, World Bank. And the first one was coordinated by Professor Kamani Samarasinghe and Dr. Siromi Pereira. During this time, guidelines for cervical cytology reporting was prepared, and we had the first Bijavira Memorial Oration done by Dr. R.S. Jayatilaka. The first EQA program also started with coordinators Dr. Palita Ratnayaka and Dr. Shireen Rosai. Now we come to the last decade of the college. It started off well. The war had finished, the country was doing well, and we had 3 presidents who did a great job at the beginning of that term. And then in 2018, disaster struck again. The Easter Sunday bombings, which was followed by the COVID pandemic, which shut us all down, to be followed by the economic crisis where we had to struggle to put petrol into our cars, which was followed by the Aragalaya, which toppled a president. Again, so much turbulence in the sea, but the college survived, thanks to some brilliant pathologists of the period, the names of whom are described there. It was extremely challenging to Dr. Shanika Fernando Pulle because she had to have the icon during this period, and the college achieved another milestone by having the conference entirely online. This gave us the confidence and the courage to know that we could now do things on the online platform, and that has led to many webinars being organized by the last few presidents. This period also saw the National Birth Defects and Feto-Infant Death Surveillance Program, which was managed by Prof. Priyani Amaratunga, with workshops being held for hospital and field medical officers, revision of guidelines on thyroid cytology and perinatal pathology, again by our president, Professor Priyani Amaratunga, and significantly, approval was given now to start immunohistochemistry laboratories in the provincial hospitals. We also awarded the Doris Pieris Gold Medal for the best candidate at the MD Part 2 examination. The college moved office from SLMA to SLCOG and later to PGIM Rodney Streets. And national guidelines for histopathology were published online. Then, another significant event. In other countries, developed countries, cancer is not reported by a single pathologist. But we have had to do this for generations. And during the last 2 years, Dr. Priyanka Abegunasekara and the president before that started peer review meetings from the College of Pathology. 2 other events which I think were very significant was the starting of the molecular genetic laboratory at the Apeksha Hospital, Maharagama, which was spearheaded by Dr. Priyangi Amarabandhu, and National Hospital Kandy, spearheaded by Dr. Palita Ratnayaka. And the first referral center for cancer diagnosis and research was also established at the Faculty of Medicine, Colombo. And there you see some pictures of the molecular genetic laboratory at Apeksha Hospital. We are all very proud of that. And the molecular genetic laboratory, National Hospital, Kandy. And this shows the way the Sri Lanka pathology has gone. The SEDAC labs. So Sri Lanka has finally come up to international standards. So, ladies and gentlemen, in a brief period of, I hope I have not gone beyond time, I have given the highlights of the 50-year odyssey of the College of Pathologists. But the odyssey does not end here. It will have to go along. We may face various turbulences, stormy seas in the years to come. I have not summarized all the activities of the college because it is not humanly possible to do so in 25 minutes. But details will come in this book, The Final Diagnosis, a 50-year odyssey, which will be launched at the end of the year. And I think every college member should purchase this book, which will be like a coffee table book, which you can proudly keep and read. So, 50 years later, we still continue our journey, now under the able leadership of a new captain, someone whom I call the bionic woman of pathology because she is so efficient, Professor Priyani Amaratunga. And I'm sure she will start the journey in style. At this stage, I also wish to pay a tribute to all the pathologists who have struggled to continue their services throughout Sri Lanka. It has not been easy for you. We know that. I know that. But in spite of the difficulties, you have continued. And I think you deserve a standing ovation. I quote from the poem If by Rudyard Kipling. And so my message to the junior pathologists who are working outstations is, if you can force your heart and nerve and sinew to serve their turn long after you are gone, and so hold on when there is nothing in you except the will that says to you, hold on. Material for this lecture was provided by Professor Isha Prematilaka. A huge thank you to her and also to her husband who quickly designed the book cover so that it could be put up, and Dr. Palitha Ratnayaka and Priyangi Amarabandhu also provided some questions, photographs. As I conclude, I pose a question to the College of Pathologists of Sri Lanka. Quo vadis? Quo vadis in Latin means, where are you going? And this was the term that Dr. Rani Pereira used for her editorial in the first journal of Sri Lanka, the College of Pathologists of Sri Lanka. And I hope some young visionary pathologists in the audience will meet me in the entertainment time and say, the next ports of call for the college will be digital pathology, artificial intelligence in pathology, and molecular diagnostics. Thank you very much.
Thank you, sir. I would now like to invite Professor Priyani Amaratunga to present a token of our appreciation to the guest speaker for the evening, Professor Chandu De Silva. Thank you, sir. Today's celebration is the first of many events lined up to celebrate the Golden Jubilee of the College of Pathologists of Sri Lanka. We would now like to give you a glimpse of activities that are planned for the year ahead.
"2025 marks a momentous occasion, the 50th anniversary of the College of Pathologists of Sri Lanka. For half a century, this esteemed organization has been at the forefront of advancing pathology, shaping healthcare, and safeguarding the health of Sri Lankan nation. From its beginnings to its current stature, the college has been a center of expertise, dedicated to cancer diagnosis, promoting pathology education, research, and public awareness. This anniversary is a celebration of our legacy, a reflection on our achievements, and a vision for the future. The highlight of our year-long celebration will be the 50th Anniversary International Conference, held in October 2025 at the UCFM Tower, Faculty of Medicine, University of Colombo. Under the theme, Commemorating the Past, Excelling in the Present, and Aspiring for the Future, this conference promises to be a landmark event.
50th Anniversary International Conference is a golden opportunity for all Sri Lankan pathologists to reconnect, foster lasting friendships,
and to share their expertise. We also welcome international colleagues to experience the warmth of Sri Lankan hospitality and engage in productive dialogues in this global platform.
We are honored to welcome distinguished speakers from the British Division of the International Academy of Pathology, the United States, Australia, Europe, SAARC countries, and our very own esteemed local experts.
My name is Jan van der Tuzen, and I'm the current president of the British Division of the International Academy of Pathology, or BDIAP. It is my great pleasure to have been invited to represent the BDIAP and to also give a talk at the upcoming 50th Anniversary International Conference organised by the College of Pathologists of Sri Lanka. As BDIAP, we've had a very friendly and long-standing relationship with the College of Pathologists of Sri Lanka, so I hope to see many of you there in Sri Lanka later this year.
The program will feature engaging endowment lectures, commemorative symposia, hands-on workshops, and cutting-edge research presentations, fostering collaboration and knowledge exchange. We look forward to welcoming you in Colombo for collaboration and learning. We are committed to nurturing the next generation of pathologists. Pathmaster Challenge, the interfaculty pathology quiz, will ignite passion and knowledge among undergraduate medical students from all state universities. We have also initiated a video competition on cancer diagnosis and awareness, encouraging students to create impactful content for public education. Public awareness is paramount. Through press releases, social media campaigns, and outreach programs, we aim to educate the public about cancer and highlight the crucial role of pathologists in disease prevention and diagnosis. To preserve our rich history, we are proud to announce the publication on the history of the College of Pathologists and Laboratory Medicine in Sri Lanka, a comprehensive book detailing the 50-year journey of the College and Laboratory Medicine in the country. This publication will serve as a valuable resource for future generations. Invaluable training opportunities will be provided for our members and technical staff through specialized workshops. These workshops will cover essential topics such as laboratory accreditation and specialized areas in histopathology, ensuring skill enhancement. Detailed information about the regional workshops and the 50th Anniversary International Conference, including registration and participation, will be available on our website and social media platforms. We encourage everyone to join us in these enriching events. The 50th anniversary of the College of Pathologists of Sri Lanka is a celebration of our past, a commitment to our present, and an inspiration for our future. We invite you to join us in commemorating this significant milestone and contributing to the advancement of pathology in Sri Lanka. Together, we will continue to make a lasting impact on healthcare.
It is now time for a very special segment in today's events. Pathologists play a crucial role in early detection and diagnosis of cancer. Their expertise not only aids in diagnosing cancer, but helps to determine the prognosis and potential response to therapies, making them indispensable members of the oncology team.
One of the first events organized by the college to commemorate its 50th year was a video competition that was open to all the undergraduates in all universities in Sri Lanka. The theme of the video competition was to raise cancer awareness while highlighting the role played by the pathologist in cancer diagnosis. We received 23 very creative videos from undergraduates from all around the country, and our judges had a very difficult time selecting the winners.
It is now our great pleasure to invite the President of the College of Pathologists of Sri Lanka, Professor Priyani Amarathunga, and lead organizers of the video competition, Dr. Jayanjana Asanti and Dr. Deshani Walisinghe, to join us on stage for the awards ceremony. The third place is awarded to Kanesamurthy Kanujan, Yogendran Madhushanan, Vijayanti Vijayakumar, and
The pathologists, the specialists who study diseases under a microscope, take advanced machines sliced into thin sections and placed on the
Cervical cancer is preventable and treatable. We are here to help you take action today for a better tomorrow.
will be shared on the YouTube portal of the College of Pathologists of Sri Lanka, and at the end of the year, a prize will be awarded to the video receiving the most likes. So please do go online and check out the videos and vote for your favorites.
This evening, we have not only celebrated the past, but we've also looked ahead into the future filled with promise. The College of Pathologists has grown, evolved, and flourished over the past 50 years, but we still believe that the best is yet to come. As we come to the end of the official proceedings, I now invite Dr. Lalini De Silva, Joint Secretary of the College of Pathologists of Sri Lanka, to propose the vote of thanks.
Honorable Chief Guest, Professor Neelakanthi Ratnatunga, Professor Emeritus, University of Peradeniya. Guest Speaker, Professor Chandu De Silva, former Chair and Senior Professor of Pathology, Faculty of Medicine, University of Colombo. Past President of the College of Pathologists of Sri Lanka, Madam President, members of the Council, Fellows and members of the College of Pathologists of Sri Lanka, distinguished invitees, ladies and gentlemen. It is with great honor and privilege that I rise to propose this vote of thanks. As we conclude this momentous occasion, the presidential induction and the celebration of the 50th anniversary of the College of Pathologists of Sri Lanka. On behalf of the College, I extend our deepest gratitude to our chief guest, Professor Neelakanthi Ratnatunga, for graciously accepting our invitation and honoring us with her presence this evening. Madam, your outstanding contribution to the field of pathology in Sri Lanka made your presence at this historic milestone especially meaningful. We are truly grateful for your time and support. We are equally honored to have with us Professor Chandu De Silva as our guest speaker for his thought-provoking delivery of 50th anniversary lecture titled The Final Diagnosis, a 50-year Odyssey. Sir, your reflections and insight have added profound depth to our celebration, reminding us the remarkable journey of our college and the exciting journey that lies ahead. We would like to extend our sincere appreciation to the esteemed representative from the Ministry of Health, universities, government organizations, professional colleges and associations, and the special guest of our President for joining us commemorating this significant milestone. To our valued members of the College of Pathologists of Sri Lanka, whether present here or joining us virtually, thank you for your ongoing dedication and support. We continue to sustain and strengthen our college. As we proudly celebrate 50 years of excellence under the theme commemorating the past, excelling in the present, aspiring for the future, we look forward to a year filled with meaningful initiatives. Among these, we take particular pride in our video competition for undergraduate students, aimed at raising public awareness about cancers and highlighting the vital role of pathologists in cancer diagnosis. I wish to express my sincere appreciation to the organizing committee for their dedication and hard work, to the talented participants from universities across the country who submitted an outstanding array of high-quality videos, and to our esteemed panel of expert judges for their invaluable contribution in ensuring the success of this competition. Preparations are also progressing for upcoming quiz competition for medical students, and I take this opportunity to thank the organizing teams for their tireless efforts. A very special note of appreciation goes to our colleagues in United Kingdom for their generous financial support, which has been instrumental in making these educational initiatives a reality. I would also like to express my sincere gratitude to all our council members for their invaluable contributions, with particular mention of my co-secretary, Dr. Priya Amaravira, whose unwavering support and commitment have been vital throughout planning and successful execution of this event and our anniversary programs. We remain deeply grateful to our long-standing sponsors for their continued support over the years, and we look forward to their valued partnership as we embark on this special anniversary year. To Ms. Isuri Piris, our college administrative assistant, thank you for your tireless efforts. We also wish to acknowledge the management and staff of the Imperial Monarch Hotel, particularly Mr. Chamal Kanahara Arachi, for their excellent service and seamless coordination. Our thanks also extend to Mr. Ravindra Devakar and the team at D&K Production for their professionalism and expertise in ensuring smooth execution of this evening proceedings. A special appreciation goes to Channa Upuli Performing Arts Foundation for providing us with their captivating performance, which will add elegance and grace to tonight's celebration. I extend my heartfelt gratitude to our wonderful compeers, Dr. Rangana Karunaratne and Dr. Sachintana Sumanasekara, for their exceptional hosting, seamless coordination, and engaging presence that enrich today's presentation. And finally, to our families, thank you for your patience, understanding, and unwavering support. Your encouragement and sacrifice are the foundation upon which our work is built, and we are profoundly grateful. To all those, both visible and behind the scenes, who have contributed in countless ways to the success of this evening and to ongoing work of the college, please accept our deepest gratitude. If I have missed acknowledging anyone by name or have not had the opportunity to thank you personally, please accept my sincere apologies and know that your efforts are truly appreciated. I wish you all a most pleasant and enjoyable evening. Thank you.
Thank you, Madam. This brings us to the conclusion of the proceedings for this evening. Ladies and gentlemen, please remain in your seats as we have some beautiful dancers in store for you. I request the dignitaries at the head table to please take their seats with the audience. Thank you. Thank you for that beautiful performance. Dance is a form of giving new life to songs of yesteryear. The amazing dancers from Channupuli Performing Arts Foundation will be dancing to the beautiful song Anothattavila, a historical tale performed in the form of graceful movement, expressions, and romance. Sit back and enjoy this enchanting performance.
අනෝතත්තවිල නෙළුමනිලාලා පීරාවරලස මල් කවසාලා නාගලුවින් දැස නාලිය ගමනින් වරංගන පිරිවරිනා එරන්දසිය එනවා
සිතක උපන්දොල සංසිඳුවාලා මතක සිනාවෙන් මුව සරසාලා ඉරට මුවාවෙන් සඳට මුවාවෙන් සිතට තුරුළු වෙනවා එරන්දතිය එනවා
ගමනින් කෝල හැඟුම්හල කාලකිරෙන් සිතුවිලි සේනාගෙන කෝමල ගමනින් කෝල හැඟුම්හල කාලකිරෙන් සිතුවිලි සේනාගෙන
වරංගන පිරිවරිනා
අනෝතත්තවිල නෙළුමනිලාලා පීරාවරලස මල් කවසාලා නාගලොවින් දැස නාලිය ගමනින් වරංගන පිරිවරිනා එරන්ද කියනවා
සිතක උපන්දොල සංසිඳුවාලා මතක සිනාවෙන් මුව සරසාලා ඉරට මුවාවෙන් සඳට මුවාවෙන් සිතට තුරුළු වෙනවා එරන්දතිය එනවා
නලලත කුංකුම තිලකතියාලා නීල වර්ණයෙන් කැලුම් නෙලාලා නලලත කුංකුම තිලකතියාලා නීල වර්ණයෙන් කැලුම් නෙලාලා
පාදකිකිනි සොලවා එරන්දතිය එනවා
අනෝතත්තවිල නෙළුම නෙලාලා පීරාවර ලස මල් ගවසාලා නාගලොවින් බැස නානිය ගමනින් වරංගන පිරිවරිනා එරන්දතිය එනවා
සිතක උපන්දොල සංසිඳුවාලා මතක සිනාවෙන් මුව සරසාලා ඉරට මුවාවෙන් සඳට මුවාවෙන් සිතට තුරුළු වෙනවා එරන්දතිය එනවා
වරංගන පිරිවරිනා
එරන්දතිය එනවා
වරංගන පිරිවරිනා
Thank you for that splendid performance. The final item will be a dance to a very popular song of recent times, Vassanayata, a depiction of spring love performed by 6 graceful dancers in 6 unique ways and expression. For one last time, ladies and gentlemen, the fantastic dancers from the Channa Upuli Performing Arts Foundation.
මසානයට අතවනලායිමු මග බලන් උද්‍යානයක කෙළවරට වී ඔබ ඇතින් නිදන් ඉන්නවද රත්තරන් මංගාවින්ම උනොහොම නොදී මසානයට අතවනලායිමු මග බලන් උද්‍යානයක කෙළවරට වී ඔබ ඇතින් නිදන් ඉන්නවද රත්තරන් මංගාවින්ම උනොහොම නොදී හාදු දෙන වැස්සේ තේදුන්න අස්සේ අපි පාවෙමුද තුරුලටම වී ඔබේ ඇස් නස්සේ මං මාව දැක්කේ සංසාරයම මම නොපකිවී තව ඇතින් නිදන් ඉන්නවද රත්තරන් සංසාරයම මේ තිස්සේ අපි හැංගෙමුද උණුහුමට වී සමනල පස්සේ දුව පැනපු කාලේ දැන් මට දෙන්න ඔබ මගේමදී ඇයි ඇතින් නිදන් ඔය තරම් රත්තරන් මං ආවොත්ද නුඹ මට හිමි පසානයට අතවනලායි මුමග පල උද්‍යානයක කෙළවරට වී ඔබ ඇතින් නිදන් ඉන්න වතරත්තරන් මංගාවෙන්න උණුහුම නොදී වස්සානයට අතවනලායි මුමග බලන් උද්‍යානයක කෙළවරට වී ඔබ ඇතින් නිදන් ඉන්නේ ඇයි රත්තරන් මංගාවෙන්ම උණුහුම නොදී
Thank you for that amazing performance. Ladies and gentlemen, as we draw our program to close this evening, I hope it has been an enjoyable experience for all. Please rise as the ceremonial procession leaves the hall.